So there are inevitably two controversial subjects when we talk about acute illness in children: antibiotic resistance and immunization. Today, we're not going to really address immunization or vaccination. We're going to talk more about antibiotic resistance and different ways to address acute illness in children. Modern medicine takes the perspective that these are conditions that require an antibiotic intervention. I disagree with the things that we will talk about usually preclude the need for the antibiotic. It's a problematic situation though, because the child's in pain. And so generally we have to do something to relieve the pain. And if you can do that, then you can usually get some kind of a buy-in on the part of the parents for not necessarily having to pursue an antibiotic intervention. If an antibiotic is going to be used, generally the first line is amoxicillin. If it recurs, it's Augmentin. The difference is Augmentin has an added clavulanic acid, which basically covers some of the resistant strains from penicillin. This is the age of acute viral illnesses, by the way, and we'll talk a lot about that as this process goes along, because the reason why we're not having a in-person conference is because of a viral pandemic. Unfortunately, this is the world that we have created, and we have people piled on top of people in certain areas. New York is especially hard hit because there's just such a concentration of humans. That particular concentration makes it so that something that's as contagious as, say, a COVID-19 coronavirus gets moved through the population really, really quickly. Also worth considering, especially in babies, is thrush. Thrush, you have to kind of correlate to strep and staph kind of infectious processes. But thrush you'll see present in, say, inside of the lips. You might have a really overt yellow coating to the tongue, almost furry, and if you look into the pharynx, then you'll see sort of a different plaquey manifestation with fungal presence than you will necessarily with the strep kind of a presence. Glyceric acid is a wonderful addition to these other components. We call this thing that we made up glutacyst, which is glutathione and acetylcysteine glyceric acid. They have to be neutralized pH-wise with bicarbonate. So you'll notice that the bicarbonate amount is about half of the additive amounts of the others. That'll take you to a pH of about 7.4. If you want a more alkaline, add a little more bicarbonate. There's an important element that we have to talk about with urinary tract infections also, is that, regular personal hygiene is important. Dirty fingers, theirs, and someone else's. So one of the hardest conversations that we end up having with families, especially with little girls that have chronic bladder infections, is what kind of contact might they be having? We start getting suspicious pretty quickly if things want to keep happening. And it's important not to lead children to tell you that something inappropriate is happening, but rather to reemphasize that maybe something inappropriate is happening.